Hello everybody, Jeremy Latham here, I'm the hip surgeon. In this video I'm going to talk about consent. When you come in for an operation, the surgeon gets you to sign a consent form to say that you understand what's going to be done, that you're happy for the procedure to take place, and that you understand all of the risks and benefits of that procedure. But this is just the end of a very long process. I'll describe that process in more detail during the video. I hope you enjoy it. If you've got any questions or comments, please do get in touch. The details will be at the end of the video. Thanks for watching. When we want to have medical or surgical treatment, we have to give our permission or consent in order to receive it. This is an important part of the contract between patient and doctor. As a surgeon, I have a duty of care to my patients to make sure that they understand what the treatment involves. I have to be happy that the patient understands the risks and benefits of the procedure and how it will affect them. This process is called informed consent. In order to get informed consent to treat a patient, they have to understand the issues involved. The doctor has to make an assessment of that patient's capacity to understand those issues and to be happy that the patient has sufficient information in order to make a reasoned judgment about treatment. The consent has to be freely given. This means that the patient has not been coerced into having treatment by friends or family. The vast majority of doctors want to get the best outcomes for their patients. Unfortunately, this doesn't always happen. This can lead to allegations of medical negligence. The patient might say, if I'd known about that complication of treatment, I would never have had it done. Failure to show that informed consent was obtained for a particular treatment is one of the commonest causes of litigation for medical negligence. Recent case law has changed the way that doctors must approach the issue of getting informed consent. The ruling in the Montgomery v Lanarkshire Health Board in 2015 stated that doctors must take reasonable care to ensure that the patient is aware of any material risks involved in any treatment and of any reasonable alternative or variant treatments. A material risk is one in which a reasonable person in the patient's position would be likely to attach significance to the risk, or the doctor is or should reasonably be aware that the particular patient would be likely to attach significance to it. This has been a significant change in law. Before this, the Bolam principle applied. The Bolam test states that if a doctor reaches the standard of a responsible body of medical opinion, he is not negligent. The Montgomery ruling has changed significantly the test which must be applied in cases of medical negligence. Doctors now have a much more explicit duty of care to ensure that patients understand the risks and benefits of all the different treatment options, not just the ones that the doctor thinks are significant. So how does the consent process work in practice? First of all, I see you in clinic, we discuss the diagnosis and plan treatment accordingly. Sometimes there may be no treatment at all. The risks and benefits of treatment are discussed. I summarise all of this in a letter which I send to your GP and send a copy to you. I make sure that you understand that you can always speak to me again, either in person or on the phone or by email, so that we can discuss any questions that you might have or clarify anything that you're not sure of. On the day of surgery, I ask if you still want to have the operation and make sure you understand what's involved. I put a big mark on the limb to make sure that we're doing the correct side, and I ask you to sign a consent form. You can see that getting informed consent is not just an event on the day, it's actually a whole process which starts several weeks beforehand. Well, I hope that you found that helpful. Issues around consent are of course very topical at the moment and not just in healthcare. My duty as a surgeon is to provide you with enough information so that you can make an informed decision about the treatment that's proposed for you, whether that's surgery or no treatment at all. The decision we make is a shared decision, and that's very important. If you've got any questions or comments, please do get in touch. If you like the channel, please subscribe. Thanks again for watching. I'm Jeremy Latham and I'm the hip surgeon.